trouble with my earphones.
Put reading glasses on or leave them off.
You might, if you need to read
If
with
you
them.
need to read. It's really
It might-
Don't let money mistakes send you to the sidelines. Meet a financial advisor who knows your smartest investments include seizing the day. From the News Channel 5 network, this is In Your Prime. And now your host, Dr. Friday.
G'day. Thank you for joining me today here on In Your Prime. I'm Dr. Friday, your money doctor, and we're going to help you guys figure out Medicare. Okay? And we're going to do this together because I can honestly tell you, I'm not an expert at this, but I have been fortunate enough to get two experts in here. I have Kelly Fry with HealthSpring and Kim Fry with HealthSpring. You guys knew I was going to mess that up, didn't you? And Kelly Albert with Cornerstone Brokerage. And thank you for accepting that. And then, Kelly, why don't you tell us a little bit about what Cornerstone does?
We are a full-service brokerage, and we handle about any kind of insurance need any of our clients could possibly bring up. Currently, though, we're in a short or a 6-week window for Medicare beneficiaries to enroll in Medicare-related plans. So that's the hot subject right now because there's such a short time period, such a small window that the phones are really staying busy with Medicare eligibles that are really confused.
So I guess one of the first things I would ask is, unlike people that, if I want to change my insurance today, I go change it, right? I mean, I don't have, but Medicare recipients only have this window. Is that what we were saying? They only have now from November 15th till the end of the year, I believe it is, right, to have actually made this choice or change, and then they're locked in for the next year?
Correct.
Pretty much?
Correct.
Okay.
There is a short window from January 1 to February 14 to disenroll.
Okay, well.
if you don't like what you did in December, you can get out in January, but hopefully you've made a good choice in December and you will live with that choice through 2011.
Okay, so we all keep hearing about this, basically 4 parts to Medicare that I understand, A, B, C, and D. Right. What does that mean, really? I mean, what, can you give us a little bit about what does A, B, C, and all that stand for?
Yeah, I'm going to defer to Kim. Let Kim take it.
Okay.
All right. Well, basically, Part A is your hospital insurance. Okay. That has to do with the facility, and that's usually you have to work 10 years or 40 quarters to get that. Okay. Normally, that's a lot of people just assume that's automatic. Part B is your physician charges and things like that, and generally you have a premium for that, and you apply for that. Okay. Part D is your pharmacy or prescription drugs, and then Part C is Medicare Advantage plan, which is what HealthSpring is.
So you're the one that fills that gap. So I'm going to go back to you, Kelly, because you mentioned that part of your service is to take a look and see what's best. I mean, you're a brokerage, so you're basically, I would come to you for all my insurance needs.
Correct.
But if I was a senior and I'm a part of Medicare, I would come and say, okay, do I need a supplement? Do I need to go for C? I mean, is that way that kind of works, or kind of walk me through how this works for you?
Correct. Once again, there's 4 parts, A, B, C, D.
Right.
D is the drug. Everybody's going to want D, but that doesn't matter what we do. But A and B, A, as Kim touched on, is generally automatic. Okay. B, you would need to go to Social Security and enroll for Part B benefits.
So one of these is what comes out of the benefits. It's a fee that's usually associated.
It's deducted from your Social Security,
right.
And you actually enroll in Part B at the Social Security office.
Okay.
Once you have A and B in place, now you have hospital and doctor benefits.
Okay.
They're not. There's still a lot of holes in that A and B or a lot of liability, a personal liability that needs to be addressed. Okay. To address that, that's where a supplement might come in to cap your liability, right, or maybe fill some of those copays or the holes or deductibles that are in play, or you also have the option, this is where people get confused, you can actually opt out of A and B and move over to